23rd episode on Nursing Officer with Pratiksha Bhandari under Nursing Concept and Principles. Today we will be discussing on ICN Code of Nursing. Contents are background, fundamental responsibility of nurse, and ICN Code of Ethics for nurses. International Council of Nurses, it was founded in 1899 and is headquartered in Geneva, Switzerland. It was the first international organization for healthcare professionals. And we need to understand code of ethics. A professional code of ethics is a formal statement of group ideals and values that serves as a standard and guideline for the group's professional actions and informs the public of its commitment. दुईटा मेजर रोल हुने भयो है प्रोफेसनल कोड अफ इथिक्सको। एउटा भनेको चाहिँ स्ट्यान्डर्ड अथवा गाइडलाइन भयो प्रोफेसनल एक्सन्सको लागि, अर्को भनेको पब्लिकहरूलाई कमिटमेन्ट गर्ने आफ्नो एक्टिभिटीहरू के छ, स्ट्यान्डर्ड अथवा गाइडलाइन के छ अथवा आफ्नो एक्सन्सहरू के छ, द्याट आर कमिटेड टु द पब्लिक थ्रु द कोड अफ इथिक्स। एन्ड देयर इज द नीड अफ नर्सिङ that is universal, and inherent in nursing is respect for life, dignity and rights for men. यो चाहिँ बेसिक इसेन्शियल थिङ्स हो है नर्सिङमा। रेस्पेक्ट, लाइफको रेस्पेक्ट, डिग्निटी एन्ड राइट्स अफ मेनलाई रेस्पेक्ट गर्नु, दिस इज द इसेन्शियल थिङ अफ नर्सिङ। एन्ड दिस इज नट रेस्ट्रिक्टेड बाई नेसनालिटी, रेस, क्रिड, कलर, एज, सेक्स, पोलिटिक्स or social status. Nothing bound the respect, dignity or rights of men in nursing. We serve the people, we serve the patient irrespective of these things. Nurses render health services to the individual, the family and community and coordinate their services with related groups. Fundamental responsibility of nurses हेर्दा फेरि मेजर चारवटा छ है। That they are to promote health, to prevent illness, to restore health and to alleviate suffering. These are the major four fundamental responsibility of nurses. हाम्रो मेजर करिकुलममा भएको भनेर ठ्याक्कै टपिक चाहिँ आइसिएन कोड अफ इथिक्स भयो है। यसमा चारवटा प्रिन्सिपल एलिमेन्ट्स अथवा देयर आर 4 एलिमेन्ट्स अफ कोड। दे आर नर्सेस एन्ड पिपल, nurses and practice, nurses and the profession, and nurses and the co-workers. Let's see nurses and people. The primary responsibility of nurse is to people requiring nursing care. जसलाई nursing care required छ, we give care to those people. Similarly, we promote the environment which will be helpful to their values, customs and spiritual beliefs. We respect all these things as nurses, and we hold confidence, that is we keep their information confidential and use judgment in sharing the information about our patients. Similarly, we advocate for the justice and equity of resource allocation and access to health care and other social and economic services to the people. For example, if we have poor patients and we know about the scheme, social service scheme or poor scheme or any other type of facilities, social facilities or economic services available, we would happily and openly suggest the group of people that need the services. And we demonstrate professional values such as respectfulness, responsiveness, compassion. Yes, we recognize the suffering of others and then take action to help. This is compassion. Trustworthiness and integrity. Having integrity, that is we have sound moral characters and we are honest. And these are the standards for people by nurses. Moving to nurses and practice. We carry personal responsibility and accountability for nursing practice. So For that, we maintain competence by continuous learning to build our appropriate practice, and we always try to maintain a standard of personal health so that we could healthily and happily provide care to our patients and their care is not compromised. We nurses use a judgment regarding individual competence when accepting and delegating responsibility. Next one is we maintain standards of personal conduct. हामीले जुन बिहेभियर हामी डे टु डे लाइफमा गर्छौँ, it would show or reflect our profession and enhance its image on the public. The nurse, in providing care, ensures that the use of technology and scientific advances are compatible with the safety, dignity, and rights of people. We ensure these things before using the technology and scientific advances, and we strive to foster and maintain a practice culture promoting ethical behavior and open dialogue. हामीले ethics law भनेर अगाडिको एपिसोडमा हेरिसक्यो हैन, त्यो बुझ्न पनि हामीलाई जरुरी छ हैन. एथिकल इश्यूज, लिगल टर्मिनोलोजी इन नर्सिङ भनेर हामीले अटोनोमी, इन्फर्म्ड कन्सेन्ट, टट, माल प्र्याक्टिस, नेग्लिजेन्स यो सबै कुराहरू हेरिसकेछौँ हैन. हामीलाई यो कुराहरू पनि बुझ्न जरुरी छ फर एप्रोप्रिएट प्र्याक्टिस. नेक्स्ट वान इज नर्सेस एन्ड द प्रोफेसन. प्रोफेसनमा यसमा हामीले प्रोफेसन मेन्टेन गर्नलाई प्रोफेसनल अपलिफ्टमेन्टको लागि रिसर्च गर्ने एन्ड फर एप्रोप्रिएट केयर अफ द पिपल एन्ड सो आवर प्रोफेसनलिजम वी ensure the appropriate environment for our patients. We play a major role in determining and implementing the acceptable standards of clinical nursing practice, management, research and education, and we should actively involve in developing and sustaining professional values. Similarly, research-based knowledge that supports evidence-based practice should be developed. The nurse, acting through the professional organization, participates in creating a positive practice environment and maintain safe, equitable, social and economic working conditions in nursing. Overall, nurses को लागि नै the environment should be safe, equitable and economic working conditions should be appropriate. The nurse practices to sustain and protect natural environment and is aware of its consequences on health. The nurse contributes to an ethical organizational environment and challenges unethical practices and settings. The last one is nurses and co-workers. What we nurses do is we try to maintain collaborative and respectful relationship with co-workers in nursing and other related fields. We take appropriate action to safeguard individuals, families and communities when their health is endangered by a co-worker or any other person, and we take appropriate action to support and guide co-workers to advance ethical conduct. These are the code of ethics for nurses and co-workers, and it's all. Now let's see two MCQs which are so common in entrance examination. The ICN is headquartered in, next one is the ICN, International Council of Nurses, was established in the year. These are the two major MCQs which are asked in general entrance examinations, and we see hints in previous slide. That is, International Council of Nurses is headquartered in Geneva, Switzerland and founded in 1899. So the correct answer is the ICN is headquartered in Geneva, Switzerland. The ICN Council of Nurses was established in the year 1899, and it's all about ICN Code of Nursing. Thank you for watching. ICN Code of Nursing will be discussed on 24th episode, and subscribe us for getting notifications to our updates. Thank you.